I'm Mandy from Dr. Goco's office, and we would like to introduce our newest employee at GCA. This is Westine.
Hey,
she will be the newest, the face you see when you walk in the door. Bear with us, this is our first Facebook Live video. So to welcome her, we are going to do a skincare consultation with our new Vizia skincare complexion analysis. So we're going to kind of walk through the steps, and this is what we do with most of our new patients and anytime you're interested in getting started on a new skincare routine. So we'll walk through those steps. So,
and I'm excited to be a part of this great team and look forward to meeting each of you.
We're excited to have you.
Thank you.
All right, so this is our new Vizia skincare machine, and let's see, I'll have you put this headband on. If you'll push all of your hair back, because it will count any little hair as a wrinkle. We don't want to do that. This lovely cape on you. Let's see if you'll hold your hair back for me. Perfect. Okay. All right, so normally we would start with cleansing your face, and then we will start with pictures. We usually do 3 pictures. So I'll just kind of show you the first picture, how we would start. Just put your chin here and forehead against the bars. And we'll have you close your eyes. And then we usually will take the picture, and it will flash about 3 times. And then we scan the pictures in, and then we will do 2 more pictures as well. But that's how it starts off. And then, let's see. Go to... We put your information in and your date of birth, and it compares you to 100 other people that are the same age. That's where it comes up with your percentages. And there's quite a few different categories. So as you can see, this is Westine. This is her, the first category is spots. So it's comparing you to those 100 people, and it gives you a percentage from 0 to 100. The higher the percentage, the better. So this is spots, and under spots it could be brown spots, freckles, a pimple, it could be anything. So that's so what is in the blue line is what the system is detecting as a spot. And it gives her her percentage. And then the next category is wrinkles. And of course it's focusing around the eyes for the crow's feet. The next category is texture. And texture is the smoothness or the roughness of the skin. And of course we'll talk about some products and treatments that can help with all of these categories too. The next category is pores, and this is the size of your pores. Of course, there's lots of different things that can affect the size of your pores and that can help improve those. This next category is UV spots. So this is the UV light, so this is the underlying sun damage. Most of this damage was probably done by the time you're 20 years old. Just as we age, it starts to come to the surface. But it's nice to see what's underlying, so you can make sure you wear your sunscreen and be protected going forward. The next category is brown spots. It's brown spots, which is the current sun damage that we see when we look in the mirror now. And then we have the red areas. The red areas has to do with vascular, and there's lots of different things that can make this a little better, a little worse, depends on that time of year. If it's really cold outside or really hot outside, it can increase the redness. And usually lasers are a good option for the redness. And porphyrins are oil and bacteria. And so it doesn't necessarily mean you have to have acne skin to have a lot of porphyrins, but you could have oily skin, or even if you have dry skin, you may just need to cleanse a little better using some type of cleansing brush or something to really clean out the pores. And then it gives you an overview of your skin and the percentages in each category. And we'll usually print these photos off for you, and you can take them home, and it's it's great for motivation on what you need to do to your skin. And if you use Latisse, we also have a category where we can measure your lashes before you start using Latisse, which is pretty cool. and then each time you come in, we'll compare your results. And we usually have you come back in for a follow-up about every 6 to 8 weeks, and then we can compare your results to the last time and see what's working or what's not working, so it's very cool to see your progress. All right, go back to the main pictures. Okay, so Esteem, what is your top concerns with your skin?
I would definitely say the sun damage.
The sun damage? Okay.
Yes.
Okay.
And brown spots and
Okay.
wrinkles.
Wrinkles. Okay.
Yes.
What are you currently using right now? As far as
Currently, I'm using no clinical skincare products.
Okay. Okay.
Yeah.
Are you willing to, use several products, or what kind of time are you willing to put in your skincare routine daily?
I'm willing to put in the time if
Okay.
I see an improvement. Yeah,
Okay.
for sure.
Yeah,
Would
okay.
love to get on a routine.
Okay. Well, I'll recommend a few different things we can do to help you get going in the right direction. As far as for the sun damage and the brown spots, with that being your biggest concern, we have lots of great skincare lines here. Obagi is one of the ones I would recommend to get you started, and it's got quite a few steps, but it's great to use. It comes in a full kit, and we usually recommend you use it for about 3 or 4 months to begin with. And it's great for lines and wrinkles, sun damage, pores, kind of all the above. It's going to address all those issues.
Right.
And I'll type up a regimen for you on how to use the steps AM and PM.
Okay.
But it's a great transformation, and then when you get to the results you want to see, we can kind of switch you to another skincare line to maintain those results.
Sounds good.
And then product or treatment wise, we have several different options too, but a good place to start as well is a series of chemical peels.
Okay.
VI peels are a very popular one where you get great results too. You do have quite a bit of peeling with that, but you could start with one peel and wait about 4 to 6 weeks, and we'll have you come back in for the next peel.
And tell me exactly what that does.
The VI peel it's got several different ingredients. It's got TCA, salicylic acid, vitamin C, retinol. We apply the chemical peel, and a lot of people think chemical peels do burn, or most of them are very tolerable. It does have phenol, a numbing agent in it, so it helps to, it's really not painful at all. But we apply the peel, you leave it on for at least 4 hours, and then after that 4 hours you wash your face and you have a take-home kit, and you apply the retinol pads. And then we explain to you how to do that. And then usually about 48 hours after the chemical peel, you'll start the peeling process. So then once you start peeling, it's important not to pick or go in the sun or anything like that. But usually peeling is like 3 to 5 days or so. And so from start to finish, I'd allow a good week. And then but it helps to remove the brown spots. It helps to tighten your pores, helps with any breakouts or blemishes. It just gives you an overall enhanced complexion. So it's a great start to do before you start a regimen, and to maintain the results too.
Okay.
And then we'll have you come back in like 6 to 8 weeks and do the Visiga pictures again. We'll compare the results.
Okay.
So
Sounds
so
good.
yeah. Do you have any other questions or?
Outside of the chemical pills, what else would you suggest?
We could do the Fraxel laser is
Okay.
also a great option for the sun damage, which is what one of your biggest concerns is.
Right.
The Fraxel laser we usually recommend a series of at least 3, spaced about 4 to 6 weeks apart. The laser is going to go a little bit deeper, but we can do the 1550 wavelengths for the sun damage. We do a little bit of numbing cream, about an hour of numbing cream beforehand, and I would say you're a little red, little swollen for a few days.
Okay.
And some of that pigment can turn a little bit darker, and then it'll flake off after a few days.
Okay.
So that would be another great option as well.
Okay.
So.
Well, I'm looking forward to getting rid of some of this.
Well, good. Well, I'm excited to help you start this journey. So.
Thank you.
Yes, you're welcome. We're very excited to have her, and we hope to see you soon.